Thank you. Thank you, Chairperson, and thank you all of you being present with us since I'm the last batsman now. And maybe in this all we are having the last session today. So, stress management in the diabetes, role of yoga, meditation and the spirituality. So, starting with the quote of Pujya Gnanasal Swami. Why we are having more stress nowadays and what we were facing previously before 50 years. So he is quoting this in his all of the pravachans. So these are the times of fancier houses but broken homes. These are the times of double income families but more divorces. These are the times of broader highways but narrower viewpoints. These are the times of high-rise buildings but low-rise characters. These are the times of good profit in families but shallow relationships. And most importantly, these are the times when the man travels to the moon but find it difficult to cross the roads and meet the neighbors. So this is why we are having the stressful conditions in maybe last couple of decades. So what the additional burden a diabetic patient is facing when the management of diabetes is there. So understanding the stress in the diabetes, first is that it is a lifelong disease. 24/7 diabetes management creates a constant stress in the patient. When you ask that patient that you have to monitor your food, you ask that patient you have to check the sugar 4 to 6 times in a day, you ask that patient you have to take the insulin 4 to 6 times in a day, and the patient is always having the fear of complication. Another important point is that stress hormones can spike this glucose level. So that is a big impact on the glucose. And what is the pathophysiology behind this neuroendocrine pathway? The chronic stress activates the HPA axis and it increases the cortisol level. And this cortisol can increase the gluconeogenesis. It promotes the insulin resistance, lipolysis and proteolysis. Another activation of the sympathetic system that elevates the catecholamine that impairs the insulin action and enhances the glucogenolysis. Inflammatory cytokines are increased because of stress, IL-6, CRP, TNF-alpha that contributes to the beta cell damage. So what kind of behavioral change a patient can face when he is in the stress? There can be the emotional eating. Patient doesn't know that what he is eating or in the stressful condition. Many of the patients is having some specific diet or appetite they will indulge into. So stress triggers are unhealthy food choices, medication non-adherence. Thaki gaya, હવે નથી ખાવી. So stress leads to missed doses or the erratic schedules. Sleep disturbance is very common in the stress, and the most importantly, the substance abuse. So all this can lead to the complication, and we know the long-term effect of the stress, that is wear and tear and the burnout and the poor self-care with erratic eating and the missed medication that leads to the complications. So what can be the triggering factors for the stress for the diabetic patients specifically? Eating restrictions, medication routines, glucose testings, fear of complication. This can be the factors, and we have to remove those factors when we have to remove the stress from the patient's life, and we have to identify the triggering factors and we can act upon that part. So cognitive coping strategies like the reframe the stress, alter the perception to reduce the impact, positive thinking in the patient's mind, focus on the solution and the strength rather than the counting down the problems, and the past successes like the draw the confidence from the previous achievements. Many of time patient has come to you and they definitely ask that, sir, why my sugar is on higher side when I'm doing all these things. So just go back to 1 year, 2 year back and see the reports of the patient. See, you have very good control previously also what you are doing at that time. That may be your success story and you can definitely do the similar thing again. So I'm not going into the detail of all these things, and I'm again not going into the detail of how the yoga is helpful in the diabetes management, but how the yoga can be helpful into the stress management. We will focus on that part. So yoga integrates the physical, respiratory and the mental exercise, reduces the cortisol and improves the parasympathetic activity. It enhances the insulin sensitivity, reduces inflammation. So we all know that yoga basically originated from the India for 5,000 years ago. It is a perfect balance of body, mind and the emotion. It increases the evidence that yoga practice tackles the pathophysiological mechanism of diabetes and the stress. It helps in the controlling diabetes and its complication. Yoga practice is a complex intervention with the various components that includes the cleansing process that is known as Kriya, the asanas, postures, the controlled breathing like pranayam, meditation, relaxation, chanting mantras, yogic diet, code of conduct, philosophy, and the spirituality. So all these have the scientific background, and there are various research papers on all each and every one of that. So yoga impacts on the insulin and the glucose regulation. It normalizes the insulin glucose ratio effectively, and it improves the metabolic function. So ancient Indian science is there behind the yoga. Yoga is a holistic system combining the physical posture, breathing, and the meditation. It promotes the mental clarity and the emotional balance beyond just the fitness. So most important thing in the yoga that is helping in the reducing the stress is a pranayama, slow ujjayi breathing, that is a deep breathing and deep breathe out, is said to enhance the parasympathetic activity. It increases the indicator of the vagal tone, and it increases the exercise and stress tolerance, and it makes that person feels calm, and breathing makes this practitioner stress free, and it increases the stress tolerance also. The 3-stage pranayama with the ujjayi breath is an advanced form of this pranayama. We all know about the Bhastrika and the Kapalbharati. We may have done this also in our life also, and this all has capacity for emotional calming and the mental activation and the alertness. And Om chanting, we know definitely since so many years that it has been found to be positively influence the health. It is based on the mind sound resonance technique that results in the removal of negativity into the life and increase in the energy. So some of the benefit of yoga practice in the type 2 diabetes, I am not again going into detail of each and every one, but if you know that Bhramari Pranayam, it soothes and calms the effect on the mind, improves the mental and physical health. Shitli Pranayam, it has a cooling effect, lower the blood pressure. The Chandra Bhedan, it has a parasympathetic stimulation, like the Bhastrika Pranayam, regulate the pineal, pituitary and adrenal glands. It improves the role in the regulation of the metabolism. The Hasta Mudra, like the Appan Mudra, or if you do the Gyan Mudra, it promotes the deep relaxation and it eliminates the stress. So yoga practice has increased behavioral changes. It helps you regulate your physical activity, daily motivate the physical activity, adherence to the diet and the medication, psychological impact like the increase in the quality of life, it improves the mood, it decreases stress, apart from all the physiological effects. There are so many publications are there. Definitely we don't have that much publication on the effect of yoga and in the stress in the type 2 diabetes specifically, but how yoga is helpful, we are having these publications. Meditation, it is focusing on more on the awareness and the relaxation technique to calm your mind. There are two types: mindfulness based stress reduction meditation and the transcendental meditation. Deeper the meditation, more the effect of this meditation. So what is the psychophysiological mechanism? Autonomic adjustment, it decreases the sympathetic tone, it increases the vagal tone for the relaxation. Hormonal regulation, it decreases the cortisol and the adrenal level, it increases the melatonin and the growth hormone level. On the brain, it boosts the prefrontal cortex activity to reduce the impulsivity and improves the coping mechanism. And the emotional relief, it lowers the distress related to the diabetes and other chronic mechanism. And the third and most important thing is the spirituality, how the spirituality can be helpful in reducing the stress. Belief in the higher power can foster the comfort and the hope. The search for the meaning in life helps the patient to find the purpose beyond the illness. So spirituality extends beyond the organized religion to personal belief. So what can be the impact of spirituality on the diabetes? It enhances the acceptance of the illness. In the spirituality, there is one say that je થાય છે સારા માટે થાય છે. So if the person is believing that if I am getting the illness, it is because of maybe because of my past karmas, or it may be because of the God wants to examine me, he wants to taste me, the spirituality, then the patient can definitely accept the illness. That promotes the optimism and the resilience, reduces the feeling of burden and the hopelessness, encourages the healthy behavior. Role of spirituality in the emotional well-being. emotional strength, spirituality brings the motivation and the emotional resilience, self-care, positive belief enhance the adherence and the self-efficacy. And the spirituality nurtures the hope and the acceptance in the adversity. So whatever the adverse condition the patient is facing, but there is always a hope. And there are two big mantra what is definitely helpful in my personal day-to-day clinical practice, so that I always ask the patient who are facing the stress. The first is the slope from the Bhagavad Gita, Karmanyavadi karashe mafalesho kadashina. What that means, what your purpose of the life or what is your doing is that you have to do your karma when you have taken the life on the earth, but you don't have any role about what is you are getting out of your karma. That is in the hand of your supreme power, and that is not the only Hindu religion is telling. All the religions, they are telling the same thing. તમારું કર્મ તમારા હાથમાં છે, ફળ તમારા હાથમાં નથી. So why you are worried about and many of the things. The another thing is ભગવાન સર્વ કરતા હરતા છે. So everything whatever is happening or everything is going to be happen is if it is because of the God and if it is because of the divine power, whatever you are believing or not believing, then this disease is again is in the hand of the God. And we also face the similar thing in our day-to-day life also, in our practice also. If you are giving the insulin to some patient and you expect that you may get the 50 points sugar reduction, you are getting the 200 points sugar reduction in the same patient. If you had asked that patient to start any of the insulin 12 units and you are saying the maybe that sugar should be in control, but you have to opt at it to very higher level. So every patient is individualized, and I always believe that there is always some divinity behind that, divine power behind that. So each and every person is behaving differently, and we have to believe in that power also. So spirituality in the health, there are real world evidence. They have shown that glucose control is there with believers in the spirituality rather than not believers in the spirituality. Faith-based programs has happened, and there are some kind of control trials where lower blood pressure and the weight through the lifestyle support programs can be achieved. And the healthy habits, the spirituality motivates a balanced diet and the increase in the physical activity. So to conclude this, stress management is the key to controlling the diabetes and the improving the quality of life. Holistic approach blends the behavior changes with the mindset and the spiritual practice. Yoga, meditation and the spirituality have scientific support also, and the heal body, mind and the soul for lasting well-being. So this is my last slide. We now is moving toward what we call as chronomedicine, and the chronomedicine is talking about our ancient old habits. Vela uto, vela suvo, vela khao, time per khao. So all this habit what we are having in our day-to-day life before 50 or 60 years. So Brahma Muhurat, you have to be early from your bed. So an early riser earns the good health. And there are so many scientific evidences now when we are having the research on the chronomedicine. And the Ashtanga Yoga, like the Yam, Niyam, Asan, Samadhi, Dhyan, Pranayam, Dharana and the Pratyahar, all these have that factors which can help you to reduce the stress. So thank you again, thank you very much. Thank you to the chairperson, everyone.